We've nominated the paediatric therapy team because of the significant positive impact they make on the lives of children with disabilities and difficulties.
Over the past 18 months, the team have faced the challenge of losing some very experienced staff through relocation and retirement. So despite temporary significant staff shortages, the teams needed to continue to provide a service to children with various levels of disabilities in the centre, at home and local special schools. Over the last 18 months, they've all grown in confidence and have taken on new training with optimism and enthusiasm.
We've decided to use family and friends testing to gather the views of patients using our service. Some of the comments we've had is that our staff is very friendly and approachable, that they listen well and give good advice, and that they make the appointments enjoyable for their children.
The MSK ERAN team is the early rehab and nursing team with a group of nurses, physios and rehab assistants. They are involved in the care of total hip and total knee replacements, and the aim is to support early discharge from the hospital. It builds upon the work of the MSK wards, particularly Shopland ward, in allowing these patients to be discharged at 2 to 3 days post-operatively. They're then visited in their own home by a team of nurses and physios and encourage them to recover in their own home, which, as we all know, is the best place for patients to recover. The aim is to visit the patients on their first day post-operatively, and then with a series of visits by the nurses and physios for 6 weeks after their surgery, and they're then discharged in their own home.
Thank you to Kathy Maloney for nominating us. We're very proud to be nominated, especially as we're a new service, and we've worked very hard over the last year. Thanks again.
I nominated the Southend Emergency Department team for the Hospital Heroes Team of the Year award, as for me, they are the best emergency department team I've ever worked with. They really define teamwork for me in that they will do whatever is needed to deliver excellent patient care at the time. So job roles will be blurred and we'll all put hands on deck when is needed. They're incredibly passionate about the care that they give. All of them want to really give the best patient experience, and they do that in sometimes very difficult circumstances. So we all know that the department has been increasingly exceptionally busy over the last few weeks and months. And also sometimes, unfortunately, we do have patients in who may not appreciate what they are trying to provide and become abusive to them as well. Despite that, they carry on, they work really, really hard, and they remain dedicated to providing excellent patient care. They're the best team ever to work with, and I feel really privileged to do so.